Hello, everyone. My name is Christopher Gabby Vento. I work for Dr. L.S.R. Andari at the University of Toledo in the College of Medicine in the departments of psychiatry and neurosciences, and I work in the laboratory for autism and social affective neurosciences. I'm going to be talking today about chapter one of my dissertation, which is going to be uncovering biologically relevant autism subtypes using advanced machine learning techniques. Before we go on, I'd be remiss if I didn't bring this up. We had two people who we worked with in the past pass away in the past 2 months. Dr. Larry Young, who was Dr. Andari's postdoc mentor and the one who helped coordinate this data. And my sister in arms, Daniela Guma Patton, passed away in an accident. Even though I didn't meet Larry, I wouldn't be able to do this work without them. So I thought I should just bring this up. So autism comes in all different shapes and sizes. You got people who may be on the spectrum, but you might not notice it because a lot of their deficits might be minor or they might be subtle. Then you got people who have a lot of sensitivity issues, a lot of repetitive behaviors, and other issues of that nature. And you got people like Elon Musk who might be high functioning, high intelligent, but they like a lot of empathy, and they can do some decisions that can be come up as kind of bizarre to people. So autism, like my sister in arms, Danny, said in a couple of her papers, is like bubblegum. So it's like you have autism, and that's like the gum, and then it gets attached with a bunch of like other objects or items, like with gum. So autism also has core wounds like learning disability, sensory disorders, compulsive disorder, depression, auditory processing, anxiety, ADHD, and occasionally Tourette's. So autism is like a spectrum. You got people towards the so-called high end of the spectrum that can are high functioning and it can do work and are very intelligent and that kind of just live their lives like everyone else. You got people in the middle that might need some accommodations and might not be able to live on themselves. And you got people towards I don't want to come off like rude, but they kind of come off as like low end of the spectrum. They need a lot of help to meet their basic needs, and they're not probably not going to be able to work very much. Problem is none of the definitions of autism account for heterogeneity. So there's no because of that, there's no biologically relevant definition of autism or any of its proposed subtypes. They're not replicable. It's nebulously defined. There's no treatment for any of its core symptoms that might be considered pathological. There's no precise diagnostics, and there's no early biomarkers to detect autism where early intervention could be helpful. So based on this informed my question for this particular project, which is, can we build a model to effectively classify ASD and neurotypicals based on behavior, and can we generate subtypes of ASD based on that behavior in clinical data and validate them with the physiological and clinical tests? So this informed my hypothesis is that we can measure the ASD deficits and classify ASD neurotypicals using a multimodal or multilayer approach. Machine learning can be used to classify the subjects, and then we can use unsupervised machine learning to create subtypes of ASD. So basically how this worked, so my central question, my first aim was to predict ASD, second aim was to generate subtypes, and the third aim was to validate them. So basically, what Dr. Andari did when she was collecting this data with Larry, when she was at Emory, between 2012 and 2019, she brought in 40 ASD and 74 neurotypicals with IQ greater than 70, and so I had them do a bunch of tests and also had them undergo some MRIs. So the tests included here were the NeoPR, or the Big Five for the Ocean Personality Test, and the RMET, or Reading the Mind in the Eyes test by Brian Cohen, which is used to measure empathy. And there was a series of clinical tests she also used, but I'm not going to be able to cover that right now for the sake of time. And then the subjects also underwent a resting state functional connectivity MRI to look at their different brain networks. So when I got the data in 2022, I got 114 subjects with 143 features. I then used random forest trees to classify the ASD neurotypicals, Shapley added the explanation values to describe the model, and used as an extension of the model for the individual data points, which I then used K-means clustering to create the subtypes, and then I described them using causal inferences and radar plots. The model wasn't perfect, but actually did pretty well, with an average accuracy of 79%. It's very precise and has a high recall, and then the AOC is actually pretty good, 0.81. You can see with the ROC curve, the model does significantly better than chance. And then you look on the Shapley values, you can see the top contributing features were the ones that suppress the associative extroversion, the extroversion itself, also neuroticism, and then reading the mind, the eyes test, and then followed by that, we got like self-consciousness, depression, and agreeableness. So if you read the radar plot here, you can see the NTs are in green, subtypes in yellow, the subtype 2 is in orange, and subtype 3 is in blue. Subtype 1 has high neuroticism, low extroversion, and subtype 2 is the most similar to neurotypicals, and then subtype 3 has the highest extroversion. So if you look at the RMT scores, subtype 1 actually has the highest RMT score when compared to neurotypicals, where subtype 3 has the lowest, indicating that it has the highest AOC pathology, and then subtype 2 is kind of in the middle. We then looked at the functional resting state connectivity levels between subtypes, and we got significant results, particularly in the areas associated with mirror neurons of the temporal sulcus and the limbic regions, which included the ACC and insula, the supramotor motor area, and parietal cortex. Subtype 1 was shown to be the closest to the brain atlas. Subtype 3 was shown to have the least amount of connectivity compared to the other two subtypes, and then subtype 2 was shown to be in the middle. So in conclusion, can we build a model to effectively classify ESD and neurotypicals based on the behavior and the psychometry or behavioral test? The answer is yes. And can we generate subtypes of ESD with the physiological and pathological measures? The answer to that is yes. So future projects are going to look at possible pharmacological treatments of ESD. We're going to replicate and expand the study. We're going to look at women and autism, and we're going to look at behavioral treatments that can be used for ASD. That here are the list of people I want to thank.